Webster Dictionary defines paraplegia as the partial or complete paralysis of the lower half of the body with involvement in both legs that's usually due to injury or disease of the spinal cord in the thoracic or lumbar region. It describes paralysis as the complete or partial loss of function, especially when involving the motion or sensation in a part of the body. The reason for the second, more generic description is that paralysis can affect many different areas of the body, where paraplegia is somewhat more limited in extent. Paraplegia typically affects the T1 through L5 regions of the spinal cord, which run vertically from the bottom of the cervical spinal cord at the base of the neck down to the top of the sacral nerves by the pelvis. When paraplegia occurs, communication between the brain and areas of the body below the injury site on the spinal cord may be limited or eliminated. Injury levels result in different motor function losses.
A standing wheelchair, also known as a standing frame or standing device, can provide several benefits to paraplegic patients. Here are some ways it can help. 1. Improved circulation by allowing the user to change positions and stand upright. A standing wheelchair helps enhance blood circulation throughout the body. This can prevent issues such as pressure sores and improve overall cardiovascular health. 2. Bone and muscle health. Standing upright helps stimulate weight bearing on the bones, which can help prevent osteoporosis and maintain bone density. Additionally, it allows for stretching and exercise of muscles, reducing muscle atrophy and stiffness. 3. Psychological well-being. Standing wheelchairs can contribute to a paraplegic patient's mental and emotional well-being. The ability to stand eye to eye with others and engage in activities at a higher level can boost self-confidence, independence, and social interaction. And this is our manual self-operated standing wheelchair.
In order to start the lift, the user needs to apply downward pressure to the three-way acting armrest. The force that is applied to the armrest in a downward direction causes the actuating arm, which can be seen in this video, to move in the same direction. This arm is then pivoted in such a way that it transfers the force that is being applied by the user to the L-shaped lever in a downward direction. The armrest acts as a source of torque that is delivered to an L-shaped lever via the actuating arm, causing the lever to rotate in a clockwise direction about its center position, also known as its fulcrum point. The downward force is increased along an L-shaped lever and acts as an upward pushing force through the arm. This push force causes the wheelchair seat to rotate from a horizontal to an upright position by creating a turning moment at origin. To disrupt the equilibrium created when standing, the user must jerk the three-way acting armrest outward. Under weight of the user, the system would then be free to descend. The return motion to the sitting position would be dampened by the gas spring. The gas spring will be locked using the standard locking mechanism after the transformation to the sitting position is complete.